When I initially started with Children's Community Health Plan, our motto was the kinder and gentler HMO. We're a nonprofit, so we have always kept our eye on the member. But having the tools that we have through MCG helps us keep that as an educated eye with the most current evidence in what needs to be done for those patients.
I think the benefit to utilizing MCG on a day-to-day guideline or basis for my job is helpful because it helps us look into the criteria of why the patients are there. We can look into the guidelines for guidance and expectations for the length of stay and what we need to do to make sure these patients continue to move along the continuum of care within the expected time frame. So I think utilization from that aspect of it is the most helpful.
We have a team. We have a nurse, myself. We're a small company, but we were able to integrate it into our QA department, and we love it.
It just helped me understand, these complex patients, acute patients with these cabbages and stents and things like that, never working it a day in my life. So it helps you really understand the whole spectrum.
I love MCG. Again, it makes my job so much easier, and I think it does very well as far as inpatient review nurses, knowing what to do starting from day one, making sure, for example, if there's any social issues, what we need to start preparing for, guidelines, observation versus inpatient. For laparoscopic surgery, are we putting those patients under observation versus inpatient? So it's just, to me, it's more clear. We've had a lot of good feedback, and I can't say enough good things about MCG.
I like it because I like consistency, and from a compliance aspect, it's very useful for our department because we were kind of all over the place. We just now went to using MCG for all lines of business in January. So it's really brought everybody on the same page, been consistent, been able to communicate and collaborate with our hospitals more effectively because we have evidence-based material to do that. And whereas some of our lines of business, we were using clinical judgment, and everybody, it's kind of gray. Everybody's judgment's a little bit different, so it was more subjective. Now we have the criteria, so it's been a good experience.
Because we're driven by what our client uses, although I would say it's 80 to 85% MCG across the board, but since we have multiple providers, insurance companies that we work with, some are large and many are small.